Kalliga 0.15 Mg to 0.03 Mg Tablet Contraceptives are a combination hormone medication that is used to prevent pregnancy. It contains two hormones, a progestin and an estrogen. In addition to preventing pregnancy, these birth control pills may also make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect you or your partner against sexually transmitted diseases, such as HIV, gonorrhea, and chlamydia. It's recommended to take this medication at the same time every day to ensure effectiveness. Before you start taking Kalliga 0.15 Mg to 0.03 Mg Tablet Contraceptives, it's important to read the patient information leaflet provided by your pharmacist. This leaflet contains crucial information on when to take your pills and what to do if you miss a dose. If you have any questions, don't hesitate to ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. It's best to pick a time of day that is easy for you to remember, and take your pill at the same time each day. If you are taking the chewable tablet, you may either swallow it whole or chew it thoroughly and swallow. Be sure to carefully follow the manufacturer's directions for your particular brand. It's crucial to continue taking this medication exactly as prescribed by your doctor. With certain brands of birth control pills, the amount of estrogen and progestin in each active tablet will vary at different times in the cycle. It is very important that you follow the package instructions to find the first tablet, start with the first tablet in the pack, and take them in the correct order. Do not skip any doses. If you experience vomiting or diarrhea, it can prevent your birth control pills from working effectively. In this case, you may need to use a backup birth control method, such as condoms or spermicide. Be sure to follow the directions in the patient information leaflet and check with your doctor or pharmacist for more details. Taking this medication after your evening meal or at bedtime may help if you have stomach upset or nausea with the medication. You may choose to take this medication at another time of day that is easier for you to remember. No matter what dosing schedule you use, it is very important that you take this medication at the same time each day, 24 hours apart. Your pill pack contains 21 pills with active medication. It may also contain 7 reminder pills with no medication. Take one active pill, with hormones, once daily for 21 days in a row. If you are using a product with 28 tablets, take an inactive pill once daily for 7 days in a row after you have taken the last active pill unless otherwise directed by your doctor. If you are using a product with 21 tablets, do not take any tablets for 7 days unless otherwise directed by your doctor. You should have your period during the 4th week of the cycle. After you have taken the last inactive tablet in the pack or gone 7 days without taking an active tablet, start a new pack the next day whether or not you have your period. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. If your period begins on a Sunday, begin taking this medication on that day. For the first cycle of use only, use an additional form of non-hormonal birth control, such as condoms, spermicide, for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. Be sure to consult your doctor or pharmacist about how to switch from other forms of hormonal birth control to this product. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. Common side effects of Kalliga 0.15 Mg to 0.03 Mg tablet contraceptives may include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects persist or worsen, contact your doctor. If you miss 2 periods in a row, or 1 period if the pill has not been used properly, contact your doctor for a pregnancy test. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the risks. Many people using this medication do not experience serious side effects. It may also raise your blood pressure, so be sure to check it regularly and inform your doctor if the results are high. Contact your doctor immediately if you experience any serious side effects such as lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes/skin. This medication may also rarely cause serious problems from blood clots, so seek medical help right away if you experience symptoms such as chest/jaw/left arm pain, confusion, sudden dizziness/fainting, pain/swelling/warmth in the groin/calf, trouble speaking, sudden shortness of breath, unusual headaches, weakness on one side of the body, or vision problems/changes. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. If you are in the US, call your doctor for medical advice about side effects. You may also report side effects to the FDA. In Canada, call your doctor for medical advice about side effects and report them to Health Canada. If you're a smoker and over 35 years old, it's important to note that using Kalliga 0.15 Mg-0.03 Mg Tablet Contraceptives may increase your risk of stroke, heart attack, blood clots, and high blood pressure. This risk becomes even greater with age and the number of cigarettes you smoke. So, it's best to avoid smoking or using tobacco while taking this medication. Before taking Kalliga 0.15 Mg to 0.03 Mg tablet contraceptives, it's important to inform your doctor about any allergies you have to estrogens or progestins. This medication may also contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. It's also important to discuss your medical history with your doctor before taking this medication. This includes a history of blood clots, high blood pressure, cancer, high cholesterol, depression, diabetes, heart problems, kidney or liver disease, obesity, stroke, thyroid problems, and any recent or upcoming surgery. If you have diabetes, it's important to monitor your blood sugar regularly while taking this medication and to report any symptoms of high blood sugar to your doctor. If you have a condition that requires you to limit sugar or aspartame in your diet, it's important to be cautious when taking the chewable tablets of Kalliga 0.15 Mg to 0.03 Mg tablet contraceptives. It's also important to inform your doctor if you will be undergoing surgery or will be confined to a bed or chair for a long time, as these conditions may increase your risk of blood clots. This medication may also cause blotchy, dark areas on your face and skin, so it's important to limit your time in the sun and to use sunscreen and protective clothing when outdoors. If you are nearsighted or wear contact lenses, it's important to contact your eye doctor if you experience any vision problems or trouble wearing your contact lenses while taking this medication. It may also take longer for you to become pregnant after stopping this medication, so it's important to consult your doctor if you are planning to become pregnant. Kalliga 0.15 Mg to 0.03 Mg tablet contraceptives should not be used during pregnancy and may decrease breast milk production, so it's important to talk to your doctor if you become pregnant or are breastfeeding. Drug interactions can affect how well your medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Before starting, stopping, or changing the dosage of any medicines, always get your doctor's approval. Some products that may interact with this drug include aromatase inhibitors, fezolinetant, aspemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Certain drugs may also cause hormonal birth control to be less effective, increasing the risk of pregnancy. These drugs include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs, among others. If you start any new drug, make sure to inform your doctor and discuss if you should use additional reliable birth control. Also, let your doctor know if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working well. It's important to note that this medication may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using this drug. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. You can call 911 or a poison control center for assistance. In the U.S., you can contact your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's important not to share this medication with others. Make sure to have regular physical exams, including lab tests like blood pressure, breast exams, pelvic exams, and pap smears while taking this medication. Follow your doctor's instructions for examining your breasts and report any lumps right away. Keep all medical and lab appointments and consult your doctor for more details on how to take this medication. If you miss a dose of Kalliga 0.15 Mg to 0.03 Mg tablet contraceptives, refer to the package information for guidance. You may need to use additional birth control methods, like condoms or spermicide, to prevent pregnancy. If you have trouble remembering to take your pills, talk to your doctor about other birth control options. When it comes to storing Kalliga 0.15 Mg to 0.03 Mg tablet contraceptives, it's important to keep them at room temperature away from light and moisture. Avoid storing them in the bathroom, and always keep them out of reach of children and pets. When it comes to disposing of this product, it's crucial not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard it when it is expired or no longer needed. If you're unsure about how to do this, it's best to consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.